Do
All
it.
right.
All right. Okay. Hello and welcome to our poster presentation on behalf of Group 5. So our poster is titled Health is Wealth, Preventing Type 2 Diabetes in Underserved Populations Through Nutrition and Fitness. So just for some brief background, so type 2 diabetes poses a major challenge for public health and health equity, especially in underserved populations across the United States. The prevalence of type 2 diabetes is disproportionately high among racial and ethnic minorities, individuals with low socioeconomic status, and those residing in rural areas. For example, diagnosed diabetes prevalence approaches a staggering 20% in some indigenous communities, nearly triple the rate seen in the general population. This community-based intervention aims to reduce the prevalence of diabetes in an underserved population by improving nutrition knowledge, healthy food access, physical activity over 1 year, and physical activity over 1 year. Participants will attend nutrition workshops, receive discounts on healthy foods, and partake in group exercise classes. By targeting modifiable risk factors at the intrapersonal level, this program seeks to empower participants with knowledge and resources to make lasting behavior changes to lower diabetes risk.
So the goal of our intervention is twofold. We hope to improve the eating habits and physical activity levels of those living in underserved areas with risk factors for type 2 diabetes, which will in turn reduce the disease prevalence through educational initiatives and community engagement. So to achieve this goal, several objectives must be met. We're going to be helping participants developing critical thinking skills regarding how to create balanced and proportional meals without sacrificing their budget. We're going to be encouraging the purchase of healthier food options, such as fruits and vegetables, by providing easier and affordable access to farmers markets. We're going to be promoting social support and cohesion through group physical activity workshops to help community members to encourage one another to lead healthier lifestyles. We're going to be improving the built environment via pedestrian-friendly zones, bike lanes, and bike sharing programs to encourage physical activity. We're going to be constantly making adjustments to the program through real-time feedback from community forums and support groups. And finally, we're going to be ensuring that the HbA1c and BMI levels are within normal non-diabetic ranges by the end of the year-long intervention.
Intervention description. Participants of 5,000 adults aged 25 to 60 years old with high risk factors for type 2 diabetes, including obesity, sedentary lifestyle, and poor dietary habits. Inclusion criteria: individuals with a BMI over 25, low physical activity, unhealthy eating habits, and living in underserved areas with limited access to healthcare and nutritional resources. Exclusion criteria: individuals with existing diabetes diagnosis, severe comorbidities such as hypertension, hypercholesterolemia, or pre-existing mental health issues such as depression and anxiety. The following interventions will be conducted at the intrapersonal ecological level over 1 year. Number one, nutritional educational workshops. There will be monthly workshops in community centers held by dietitians focusing on balanced diets, portion control, and healthy cooking techniques, taking into account the means and socioeconomic status of the population. 2, healthy food access initiative. Collaborate with local farmers, markets, and grocery stores to provide discounts on fresh fruits, vegetables, and whole grains for program participants, with shoppers promising exclusive shopping rights to these vendors in return. 3, physical activity promotion. Organize weekly group exercise sessions led by certified fitness instructors in local parks. Sessions will include community walking sessions and low-impact activities such as yoga and cycling, for which the creation of pedestrian-friendly zones and bike-sharing programs will be instituted. 4, community engagement. Establish support groups and online forums for participants to share their experience with the program. Recipes learned through intervention and experimentation, and fitness tips to encourage others in the community and draw others into joining this intervention program.
So our logic model begins with our mission, which is to reduce obesity and other disparities available treatments for diabetes mellitus seen in underserved populations. Inputs would include coordinators and volunteers for our programs. Activities would be as listed by Abe just a second ago: monthly nutritional education workshops, creating a healthy food access initiative, instituting weekly group exercise programs, and establishing support groups, leading to hopefully an effect where studies show participants of a nutritional education program have a great chance to lower HbA1c, which was seen in about 62% of participants. By reducing overall HbA1c, participants will reduce risk for consequences of diabetes mellitus and cardiovascular disease. By also adding our healthy food initiative, as well as our group exercises and increasing community engagement for our participants, we expect to see greater declines in HbA1c, and hopefully those can be retained. Those losses can be retained over future years. And the context would be disadvantaged circumstances contribute to higher obesity rates, physical inactivity, and poor nutrition, lack of regular preventative services, delayed diagnosis.
When we're talking about process and outcome evaluation, we should start at the beginning before implementing of our intervention. So again, at the beginning, we will start with pre-testing, which will include not only simple measures of blood testing of HbA1c and BMI measures, but also a well-being evaluation questionnaire. This will guide us in order to see where we stand in the beginning. Following, we'll start our intervention. We have 3 and 6 month follow-up, and a 12 months follow-up will mark conclusion of our intervention. Why we choose the 3 months particularly, it's because the simple test of hemoglobin HbA1c measures average blood sugar level over the past 3 months. So the intervention check on 3 months will show us early signs of measures or outcomes that we hopefully will see. And at 12 months measures at the end of intervention, we will conduct our outcome evaluation, which again will conclude the qualitative measures and quantitative measures. One of the qualitative measures, again, it will include the questionnaire of well-being that will show us how our intervention was effective, see the improvement in participants' psychological and emotional status, and additional changes throughout our intervention. And of course, a qualitative side of the measures will again check the hemoglobin A1C and BMI, and hopefully we can see the changes and we'll see the numbers will go down. After all of this collected, we'll draw our conclusion to our intervention. I just want to stress out that it is essential to also continue with the regular exercising, healthy eating, and the community, and participate in the community, because the studies have shown that importance of handling diabetes not only in titles of physical activity, but also health eating, education about diabetes, and participate in all of the community outreach communities that can help us to maintain the disease.
So just to wrap up our presentation, so as we've stated, type 2 diabetes poses a significant public health challenge, especially among racial and ethnic minorities and underserved populations who experience disproportionately high prevalences. Our community-based intervention aims to address the intrapersonal risks of poor nutrition, inactivity, and lack of health knowledge driving these disparities. The goals focus on promoting healthy behaviors through education, improved food access, social support, and built environmental changes. Workshops will build nutrition knowledge, while food discounts increase affordability of produce. Group exercise sessions foster social cohesion, and bike lanes promote activity. The logic model outlines inputs, activities, and intended outcomes. Process measures will track participation and fidelity, and outcome evaluation after 1 year will assess changes in HbA1c, BMI, and diabetes incidence to determine the efficacy. Previous studies confirm combining healthy diet and exercise has a synergistic effect on reducing metabolic disease, as we see in Figure 4. And this intervention will empower participants with multifaceted resources to enact lifestyle changes to lower diabetes, to lower diabetes risk, and if effective, it could inform policies for alleviating diabetes disparities and other underserved groups via community-driven prevention. So on behalf of Group 5, we thank you for attending our presentation.